Hi everybody, I'm Sriraj. I welcome you all on behalf of NuAIg. So in this webinar series, we've been focusing on transforming the aging industry with the help of artificial intelligence and also automation. So far we've already finished 4 series on our webinars. The 4 of them covered admissions, human resources, operations, the process related to each of these areas. And the other one also covered analytical dashboards and how they can be very useful to senior care providers in terms of monitoring their functions and departments. So in this particular video, in this particular webinar, we'll be covering about how AI and automation will help, clinical operations and PACE programs at your organization. And you can shoot your questions in the question and A tab here. We'll take up the questions at the end of the presentation. So like I said, today's focus will be on how AI is reshaping, PACE plans and clinical operations management. And basically by doing this, it'll help you enable effortless compliance adherence and also, unlock your potential to achieve 100% audit goals. Along with me, I also have my colleague Jyoti, who's also an AI program manager. She'll be leading the presentation today. And the agenda for today's call is divided into 4 broad categories. So the first, we'll talk about how AI can actually help you ensure compliance effortlessly. Second, we'll also look at how AI and automation can help you streamline your auditing and reporting process. And third, we'll look at a few automation use cases that will help you better understand how we use AI and automation to meet compliance. And the final, we'll also look at how you can have real-time analytics of all this process at a single place so that you can get a bird's eye view of what's happening across. Now, before we dive right in, I just like to give an introduction about a NuAIg. So NuAIg is an AI and technology company. So we have had significant experience in the long-term care industry where we have studied multiple processes and used RPA and automation to improve this process across different functions and departments. Like I said, we are laser sharp focused on the long-term care industry, and over the years we have mapped close to more than 100 workflows with their intricacies, and we really understand what processes are better to automate and where your opportunities lie hidden. And here at the bottom of your screen, you can just look at the clients we've been engaging with. So that's about NuAIg. Now I'll hand it over to my colleague Jyoti to take the presentation forward.
So thanks, Sriraj. And hi, everyone. So to begin with the webinar, let's talk about the major community goals that the providers basically are focused towards as compliance, clinical management, adherence, reporting, monitoring, etc. And to meet these goals, n number of efforts are put in by your workforce into these repetitive, mundane, and manual activities to ensure that these goals are met, which at the same time brings down the productivity and operational efficiency because more focused efforts are put in these goals, and care planning at the same time suffers. So in this webinar, we'll be discussing about how automation and analytics is helping providers achieve their goals of 100% audit, clinical management, compliance, adherence, freeing up your workforce to take up much more productive tasks and increase the overall operational efficiency and productivity. Also, we'll deep dive into some of the industry-wide use cases for highly regulated programs and regulations. And we'll be talking about automation, like why the industry is adopting automation so often. So let's get started and see what this automation is all about. So automation or robotic process automation are these software bots or robots that act as your digital workforce, and they're capable of mimicking human behavior. They're capable of reading, writing emails, extracting data from the softwares, preparing reports, and much more. And that too, they can do it at a very high speed with zero errors. To give you a much more understanding, a much more flavor of how these RPA bots actually work, I would like to play a small video where you can see these bots extracting the data from a marketing CRM software and preparing an Excel report out of it. So that was the video where these bots were actually functioning, and all the data of those employees was extracted within just few seconds. That's the speed at which these bots function and can prepare those exhaustive reports for you within a matter of few minutes. And without any delay, now let's jump into the industry use cases where we can see how these RPA bots are actually helping you in ensuring that the clinical documentation, clinical management of those documents, adherence, compliance, and all your audit goals can be achieved. So let's talk about the very first use case and the most potential use case that we have for the quality checks and audit reporting. So the programs that are there in the industry as such, which are very highly regulated, example the PACE programs and other clinical regulations that we have. So in those cases, providers really want to achieve 100% audit goal. They want to keep a check on how their programs are running, ensuring that team members are following up the quality standards while capturing all that clinical data. And one such example is that of auditing all those clinical assessments that are done during the admission of a participant or the reassessments that are done every 6 months or if there is a change in condition. Now, it's very important to conduct these assessments within the stipulated time and without failing the quality standards, ensuring that they are following the quality standards. But due to very high volume of data, very high volume of each participant has got multiple assessments, which multiplies to huge assessments. And auditing each of them can be a challenge for program managers. So typically around 5 to 10% of their records are manually audited. And considering this whole scenario where RPA bots are deployed, as you just saw that at the lightning fast speed they work, these bots can actually extract the data for each of these participants. They can go into your EMRs, look for each participant, look for the status of their assessments, reassessments, and check whether the quality parameters are met by these assessments or not, and can rate accordingly. They can check the score of how many assessments are actually done and how many are pending. And if they're pending, then they're pending with whom, which care team member. And then this way they can prepare a whole report, an audit report with all the details extracted from your EMR systems, which ensures that you meet your 100% audit goal. You get to know the status of your running programs. You can reach out to people who are not adhering to these clinical compliances and close those loops around. Not only this, with the extracted data from these EMRs or with the help of these RPA bots, this data can be converted into analytical dashboards, which can give you and your leadership a real-time picture, insights into how your community is functioning over the month, over the year, over the location. You get to know which particular care member is functioning at what compliance rate. You get to know the compliance rate across the different participants and can reach out to the people whom you believe are lagging behind in the compliance. Also, these are just the examples of the dashboards you can see, and they are highly customizable. So you can customize them as per your needs. All right. So moving ahead, we have you know another use case for service determination request, which comes for PACE programs. So there are family members or care providers. They actually raise these requests to provide service to the participants. And these requests are very time sensitive and they have to be, serviced out within that particular time. The care team or the interdisciplinary team have to take actions without delays, ensure that the clinical data is correctly captured, and there are no miss out on any particular information, especially with respect to the clinical details. And ensuring this is a challenge for the communities because, again, going into each and every SDR, try to check their clinical data is a challenge. And not only this, with the care management that they are doing, adhering to timelines can also become a challenge. This is where the RP bots are again helping them out. They can actually, go sit in the background, continuously review all the incoming SDRs, notify the care team members to take actions. They can flag on the missing information and send out reminders if the request is pending or an extension has to be filed. And also they can track that the data is accurate and meeting the 100% compliance. Not only this, the best part comes in, as we have been mentioning, that they are capable of preparing reports. So CMS demands that all the requests related to service that comes in should be sent out in an Excel format to CMS on a quarterly basis. So these bots can also prepare those documents in the set defined pattern and can share it across with your stakeholders who can send it across to the CMS as and when required. As we have been mentioning that you can actually prepare, or you can have these analytical dashboards prepared out of the data the bots are actually capturing for you and can gain the real-time insight into your data. So the leadership can actually understand how the SDRs are actually flowing in, what are the different statuses, who all are responsible, where they are lagging, and can reach out to any person who is not, who is falling back in compliance and close that loop over there. Again, highly customizable and easy to implement. All right, so let's talk about another very important use case wherein the seniors or your participants are actually advised by the PCPs to look for the external provider and their appointment scheduling has to be done. They have to ensure that all the documents related to uh, to your uh, to your appointment are uploaded into the EMR in the timely fashion. Need to ensure that you are compliant with your clinical documentation, the quality, and everything. So again, this is challenging for them because the appointments are time sensitive, needs to be as soon as they're received, needs to be scheduled with the external provider. They have to arrange for the transportation. When on the day of appointment, attendance has to be tracked, uploaded in the EMR. At the same time, post the appointment, the documents have to be collected and again uploaded in EMR. So there is a lot of back and forth that happens, and there are multiple requests that are open, and it becomes a challenge again to keep everything in shape and without falling on any request and being compliant with all the requirements. And this is where the RPA bots, when got deployed, were able to send out alerts to the team members as there are appointment requests that have come up and needs your attention, needs to be scheduled. Once they're scheduled, the bots can actually send out the reminders that there are upcoming appointments, post which you can uh, look up for to update the attendance. You can follow up with the provider for consults. Bot can actually extract the data for all these participants with respect to all their appointments are scheduled and give you a complete report, a consolidated report to all the stakeholders, letting them know that how their appointments are functioning currently, which providers are lagging behind in submitting their consults, uh, how much time it's taking for the attendance to reflect, and you can close those loops easily. You can ensure that you are 100% compliant. You can ensure that all the data is correctly captured against all the participants, against all the appointments through these reports that the bot can extract for you on the daily basis or at the frequency that you want. Again, the dashboards can be of great use where quickly at a glance in a real time you can understand how many requests came in, how many were attended, how many were scheduled, what are the pending actions, or are there any documents that are missing. Those can be very easily glanced at, and you know that okay, these red ones are the ones where the documents are missing. So that gives the leadership an overall understanding of where we are standing today and what actions needs to be done. Moving ahead, we have another use case of care plan tracking. So each participant or senior once gets into the community, have their care plans prepared where their current problems associated with their health, and accordingly their care plans are maintained where interventions and goals are also prepared, and they have to be timely assessed and tracked to understand how the interventions are performing. Are we reviewing them continuously? Are we meeting the review dates on time or not? Or what are the different comments left by the other care team members? It's not easy for them to go and check for each participant record again and again and check for multiple interventions, their current status, their upcoming review date. But the bots can actually pull out all that information for you for each of the resident or each of the participant for these care plans and prepare a consolidated report where you get in a glance the different problems, their associated goals, and their interventions, how they're performing, which also adds to an advantage that you get to know how your team is managing this whole clinical documentation and program, and at the same time you get to know how these care plans are performing, Do you need to change the care plans because the resident needs better care and his health is not improving? So you overall try to understand the current status with and the compliance that needs to be followed with each of these care plans. Again, a very example of analytical dashboard where the care plan can be tracked. What are the different statuses? When is the review of a particular participant's care plan is upcoming? Which are all are completed? How many interventions are there? So you just get a glance of overall functionality of the care plans into your community and how compliant we are, and you can meet and you can just ensure how easily you can audit each of these care plans in just a matter of minutes. So these were a few of the examples that we talked about, and the examples, and there are n number of processes where these RPA bots can be deployed, which can ensure a better care coordination, compliance, adherence, and ensuring the clinical documentation, clinical management, care planning, everything for the resident-centric care is being met. So you see a few of the examples on the screen, and the list is exhaustive where these RPA bots have been very useful for the communities like yours. So just to summarize, the benefits of automation and analytics are like they'll reduce the inefficiencies, they'll eliminate all the errors, increase the transparency and communication, help you meet the CMS mandates, help you meet your 100% audit goals, and improve in the decision making altogether. With this, it brings me to the end of the webinar, and I would like to let you know that this recording will be uploaded onto our website. You can review it and share it across with your team members. Also, you can book a knowledge sharing workshop with us whenever you feel like, and we can explore together and can educate them on how RPA and its application can help your community. Also, with this, I would like to open the floor for any Q&As that you have for us. All right. So the very first question we have is, how do we ensure the data security? I guess that's a very important question. And so what we do is these RPA bots are deployed onto your systems, your servers, your virtual machines. So no data actually ever moves out of your community. It resides in your community, in onto your systems and always onto your community. The bots are designed in such a fashion that they are working on your systems and no data is ever moving out. Hope that helps you understand how we actually function and how the RP bots work. The second question we have is, if we if we transit from one EMR to another, how we how will be this be handled? So I guess that's a very important question, and that gives me an opportunity to also answer that RP bots can help you in even transitioning from one EMR to another. Number one, they can help you in moving all your documents against all your participants or residents from one EMR to another, mapping and uploading it against a record of those. Now, answering how will these bots function if you are transitioning from one EMR to another is, uh, so these bots overall functioning remains the same, but since you are shifting to another EMR, it's easy and they can very easily be tweaked in, can be reprogrammed as per the new EMR, and they can start functioning into your system at a very uh, low downtime, and you can have these functioning or your compliance adherence audits of through these bots back into function into your systems. All right. Uh, so the other question we have is, what changes does the workforce currently have to go through to adopt these RPA bots? So uh, so the current workforce does not have to undergo any changes in their functioning. It's just that whatever they were doing it, all those mundane activities, they can just let the bots take it over. The other day-to-day activities of theirs remains the same. There is no change management as such into their activities that they have to learn and adopt to. It's a very smooth process. These bots can function on your systems, sitting in the background without affecting your day-to-day activities, but just enabling you to achieve more in those limited period of time and get all your goals met. All right. Yeah, I guess those were the questions that we mostly had. All right. Thanks everyone for your time today, and it was great having you all on board with us. Thanks for participating and thanks for giving us time.